next session, I welcome Dr. C.P. Bansal. He's from Gwalior. For our next session, the missing middle, elevating pre-adolescence in adolescent care. Dr. C.P. Bansal is co-chair working group AH, International Pediatric Association. His areas of interest are pediatrics, adolescent medicine, vaccinology. Affiliations are IAP, AHA, CMIC, ID chapter, SAP, IPA. His major achievements are he launched Mission Uday program, Mission Kishore Uday, many other programs of IAP. Welcome, sir.
Welcome, sir. Like in every family, we have the Bade Bhaiya, Chote Bhaiya, and the Manjle Bhaiya. The Manjle Bhaiya, poor one, is the most neglected one. So here, sir is going to specifically focus on the Manjle Bhaiya, the missing middle. We also need to take care of the pre-adolescence and adolescent care. Thank you, sir, and welcome, sir.
Thank you so much. At the outset, let me profusely thank the organizers for permitting me to share my views on this very important topic. I am also grateful to esteemed and respected Dr. Raju sir and seniors present here. In fact, I will like to take you into a space between the children and the adolescent. And friends, this space we call it as missing middle. And this space is often neglected. Although this space is also very crucial for development of a healthy adolescent and of course an healthy adult. Let me begin with saying that we all agree on one point, that definition of child is 0 to 18 years. But we often miss 8 to 12 years, that is the missing middle, because even the policy makers do not remember it. But I wish to make the message very clear that this group lies well within our domain of 0 to 18 years, while currently since last couple of years, we are focusing on youth, we are focusing on yuva, that is beyond 18 years. So I will like to re-emphasize that this phase really need our attention and we should refocus ourselves on this earlier age group. This age group is neither children nor fully adolescent, but they are the fastest biological and psychosocial changes are going on in this age group. And therefore, this age group is absolutely essential. But as they do not fall in children or in adolescent, therefore they are often neglected. Neglected not only in the government's eyes, even RKSK is not giving full attention on this particular group. This group is also not gaining sufficient research and surveillance focus. Harish will agree with me. He is there from the research group. Let us begin with a case. This 9-year-old girl came to my clinic with early breast development and her classmates teased her. She was a little fat also. Teased her saying auntie. And this girl started skipping meals to stay thin. Mother reports that she has become more irritable and started withdrawing herself from the social gatherings, also from the family matters. All this is happening at 9 years of age, not in adolescent age. And thus, the take-home message is early puberty triggers body image distress before the adolescent age. Puberty is shifting earlier. All sitting here will agree with me that there is sufficient of data to say that, not even in India, but globally also. Menarche is coming down at 9 years of age. Thelarche now is appearing at 7 to 8 years of age. Why? Because we all know that there are a lot of endocrine disruptors, urbanization, plastics, pesticides, the obesity pandemic. All this is contributing to bring down the pubertal age, and it has been mentioned in 22nd edition of Nielsen that every decade leads to almost 1.5 to 3 month, it pulls down the puberty age. Let us have another case. Mind a 10-year-old boy is spending 6 to 7 hours of unsupervised smartphone, and this boy is doing, watching either the violent serials or playing video games or viewing pornography. This all results into aggression, poor scholastic performance, and also is leading to sleep disturbances. The parents was really worried now, but not earlier. So take home message is that problematic internet use and unsafe media begin before the age of adolescent. There are sufficient of evidence to say that this missing middle today is being shaped by media, not by us. The new epidemic of early digital exposure is there. Screen is introduced before 8 years of age. Almost every child at 10 to 11 years is having an account on social media. Problematic internet use and gaming addiction are emerging in earlier age group which is lesser than our adolescent age group. And again, data is tremendous. This is the first generation to grow up entirely online. The risks are devastating. The digital risks are really too much, and they are there in preteens, not in adolescent or alone. Cyberbullying, online grooming, abuse, body image distortion, sleep deprivation, all are happening in pre-adolescent, that is our missing middle, not in the adolescent alone. At that time, it is fixed. And this I do not say. The UNICEF has done the survey and they have proved that children go online as early as 9 to 10 years. And they have also said that under 12 years are often missing from research. Harish to note that they are clearly vulnerable, but research is not there to back up this point. Let us have another case. 12-year-old boy caught sniffing glue. 12-year. And why? Because he had peer pressure, lack of parental supervision, easy availability of the drugs, and ultimately this progressed into smoking just a month or two later. The substance initiation is happening before 13 years, not at 14 or 16 years. It is happening at 13 years now. And again, the Global Tobacco Youth Survey of 2019 tells the pathetic data that tobacco initiation, average age of initiation is 9 to 10. It starts at 7.5. Median age in India of cigarette was 11.5 to 10.5, and e-smoking was even lesser. And there are number of studies to say that. Friends, real stories show us the struggles. But are these isolated incidents? No. Or they are part of a bigger trend. Let us look what the evidence says. Brain is under construction. We see this diagram off and on. But look at the preteens. Look at this preteen. The cement is wet. You can mold it. But once it passes to adolescent age, you can't do anything. It is almost fixed. So if you want to take care of this, start early. Early take care of preteens, take care of this missing middle. Mental health vulnerabilities. What the mental health fact sheet of WHO says. Anxiety, depression, and almost all other mental issues, they start at 11 or 12 years of age, not in 13 or 15 years of age. Again, our 10 to 12 8 to 12, the missing middle, is the age where you want to look at them. Abuse risk, POXO report of 2020, really saddening to say that this report says that majority of cases are in pre-teens, again our missing middle, that is in the age of 8 to 12 years, and most of the cases occur below 12 years of age. Body image concerns are appearing at 9 to 10 years. We should tell them that the body is not for comparison. उसका ऐसा है, मेरा ऐसा है. It is not for teasing or criticizing our own self. ये बॉडी हमको बच्चों को बताना है कि भगवान ने उन्हें दी है, इसकी रिस्पेक्ट करें और इसको अच्छे कामों में यूज करें, उसको प्यार करें. दे शुड लव देयर बॉडी, नॉट टू कंपेयर देयर बॉडी. मीडिया ड्रिवन आइडियल शुड नॉट बी देयर. फ्रेंड्स, all these are faces of our missing middle. Someone is having body image issues, some is having drug abuse, someone is sexually abused, or is suffering from anxiety and depression, but they are telling you the truth. They are telling you strong evidences that puberty starts earlier, substance use starts at younger age, even BD at 10 to 5 years. There is digital risks, there is mental health issues, they are appearing in missing middle, and ultimately, finally, they are being abused also in the age group of 8 to 12 years. And all the evidences which I have shown are from WHO, UNICEF, ICMR, IAP, and peer-reviewed journals. So we need to focus on them. Friends, the science is clear. The risks are real, and they begin earlier than we thought. So where does this lead us? Where? Friends, clearly, adolescent must be redefined. They must be redefined. And therefore, I am forced to make this bold proposal today before this August gathering of IAP and AHA leadership, that adolescence is a phase. It is not a rigid age band, friends, it is based on evidence that we must redefine adolescence as 8 to 18. Yes, 8 to 18. Redefining adolescence is not enough. For a change to happen, we, the pediatricians, must lead the way, involving parents, schools, and policy makers to make this shift a real one. The pediatrician's role, of course, is tremendous and is beyond a stethoscope. We should monitor growth and puberty, ask about school, friendship, and emotions, offer anticipatory guidance, early counseling for child and parent, of course, is there, and finally, the advocacy at government and central level should be there. What are the early signals which we must pick up in pre-adolescence? Anxiety, perfection, school stress, early sleep, and appetite changes. We should pick up them early. Risk of undetected distress is there. We must pick up. And I think this is a simplified heads which preteens need. We do not need to go into full heads screening for pre-adolescents to elaborate their history. Just simple heads will suffice and will take lesser time. Nutrition, very essential for us to pay emphasis on nutrition. Never give them a chart कि भैया ये खाना ये नहीं खाना. Make them a habit to have healthy nutrition. आदतन वो जब खाना शुरू अच्छा करेंगे, अपने आप that will continue through the adolescent age, through the adulthood, because the cement is wet. because they are in a pre-adolescent age. So nutrition education should be creative and relatable. फिजिकल एक्टिविटी एंड प्ले अगेन स्ट्रक्चर्ड खेल नहीं खेलना है कि एक्सरसाइज कर नहीं तो डंडा मारूंगा, नो उनको अंदर से फन फन होना चाहिए, दे शुड एंजॉय इट एंड दिस रिड्यूसेस स्ट्रेस एंड बिल्ड्स रेजिलियंस, इट बिल्ड्स लाइफ लॉन्ग हैबिट and reduce of course sedentary time, so it is very essential. Sleep matters, 9 to 11 hours, promote routines early, sleep brain food hai, and now studies are there that sleep increases your immunity also, it increases your learning abilities also. Screen delays sleep, remember that. And sleep of course is very essential for the health of brain, we call it as brain fuel. Parenting in pre-adolescence is again very essential. It should be authoritative, not authoritarian. Never do control, just do coaching. Do not be managers, be mentors. Often conversation, not instruction. Build refusal skills. They should really feel pride from inside in saying no. Bring guidance on puberty and relationships. Modeling safe digital behavior. Building resilience and empathy are really very important for parents, and it is we who have to emphasize parents to do this. Safe digital habits are very essential. There is a need to bring media literacy, need to teach them about media literacy a lot. That is absolutely essential. School-based interventions are the cornerstone. We must begin from here. Life skills programs should be made mandatory by class 5. Media literacy and safe internet modules should be created, and anti-bullying policies should be reinforced and should be implemented with force. We, the pediatricians, need to play a role in preparing these modules from Government of India for various schools. And finally, we should expand National Health Mission adolescent health programs to include 8 to 12 years in all such programs and plans. We should train teachers and pediatricians as well to pick up the early signs of preteens risk. Of course, research and surveillance for missing middle is need of the day.
We have 1 minute left.
Until and unless we are able to do that, we will not be doing full justice with this cause. So call to action is recognize pre-adolescent as a distinct stage. You recognize it first, that is most important. Then build pediatric and parental capacity to recognize it and pay full attention. Integrate them into IAP and AHA modules. Two national presidents are sitting here. I will like to emphasize, sir, use your power, use your convincing ability to see to it that it is incorporated into IAP rather than going up to for Yuva and youth. Focus on this group first. Advocacy at national level is very, very essential. Friends, it's easier to build a strong children than to repair a broken adult. Finally, the closing thought is, pre-adolescence is not a waiting room for adolescence. It is the foundation of lifelong health. So friends, thank you very much. Adolescence is 8 to 18 years of age. Thank you.